All right.
My name is Marcus Burns. I'm over the age of 18 and I give Chamberlain permission to use this for educational purposes. Come in.
Hi, Mr. Burns. My name is Christina. I'm going to be performing a head to chest. I'm going to be a nurse taking care of you today. I'm going to be performing a head to chest assessment. It's going to take me about 10 to 15 minutes. Are you all right? Are you okay with that?
Yes, I am.
Okay. Well, first I'm going to perform hand hygiene. And then I'm going to close the curtain for privacy. Mr. Burns, can you verify your first and last name?
Marcus Burns.
And your date of birth?
5/19/1985.
Thank you. Do you have any allergies?
No, I do not.
Okay. And are you in any pain?
No, I am not.
Okay. Mr. Burns appears to be his stated age. No signs of distress noted. Patient is smiling. He is also making eye contact. He appears to be in a good mood. And when patient responded to my questions, his speech was coherent and clear. He seems dressed appropriately for the weather and occasion. And he is also seen that he is bathed and he is well groomed. Mr. Burns, I need to ask you a couple of quick questions.
Yes,
Do you know where you are?
yes. I'm at home.
Okay. And why are you here?
And I am here for an assessment.
Okay. What is today's date?
April 4th, 2021.
Okay. Patient is alert and oriented ×4. No physical abnormalities noted or no physical devices utilized. Okay. So next, I'm going to move on to Mr. Burns' vital signs. Upon taking his vital signs, his oral temperature was taken. It was 98.6. I also did his blood pressure in his left arm, and the blood pressure was 120/78. His respirations were 18 beats per minute. His oxygen saturation was 99% room air, and then his radial pulse was 76 beats per minute. So all of his vital signs are within the normal range. Okay. All right, so now I'm going to assess Mr. Burns' skin. So Mr. Burns' skin is appropriate with his ethnicity. There are pink undertones. There are no rashes, no visible lesions, wounds, incisions, extra date noted. I do see a visible tattoo here, but it looks as if it has healed perfectly. I don't see any rashes, lesions, or extra date noted. He does have one piercing in each ear bilaterally, but both of those two seem that they have well healed. I don't see any rashes, wounds, redness, or incisions notated there. Now I'm going to palpate Mr. Burns' skin. Mrs. Burns' skin was warm to touch. I'm going to, can I pinch your skin, Mr. Burns?
Yes.
Okay. Upon pinching Mr. Burns' skin, it was quick, elastic recoil, no tinting. Mr. Burns, can you hold out your fingernails for me? Looking at Mr. Burns' fingernails, they are clean, they are round, pink undertones. His nail profile is roughly around 160 degrees, so no evidence of clubbing. Mr. Burns, I'm also going to press on your nails. Okay, and capillary refill was less than 3 seconds, so it was nice and brisk. So now I'm going to move on and assess Mr. Burns' face. So, Mr. Burns' face, everything is symmetrical. His nose is midline. I don't see any incisions, wounds, rashes on his face. Looking at his head, it is normal cephalic. I don't see any redness, swelling, lumps, or masses. Mr. Burns, can I palpate? I'm going to palpate your skull.
Yes.
Your head. Okay, and I also, he doesn't have any hair, so there are no infestations. And again, when palpating his head, I didn't feel any lumps or masses. Now, Mr. Bones, I'm going to go ahead and move on to your cranial nerves. First, I'm going to test your cranial nerve 5. By doing that, I'm going to ask that you clench your jaws for me. Do it again. All right. So So that was the motor. That was the motor part of the cranial nerve 5. That he did that without any problem. Now I'm going to do the sensory part of it. Mr. Burns, I'm going to touch parts of your face. When you feel me touch it, please say the word now.
Okay. Now. 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 Now.
Thank you. So the sensory part of the cranial 5 nerve is intact. So both his sensory and his motor function of cranial nerve 5 are intact. Now I'm going to move on to cranial nerve 7. Mr. Burns, can you smile for me? Can you frown? Can you raise your eyebrows? Can you puff your cheeks? Pucker your lips? Mr. Burns didn't have any problems doing any of those things, so his cranial nerve 7 is intact. Now I'm going to move on to cranial nerve 11. With cranial nerve 11, Mr. Burns, I'm going to ask for you to shrug your shoulders, and then I'm going to push on it with resistance at my command. Mr. Burns, can you shrug your shoulders? Okay. Thank you. Mr. Burns was able to do that with no problem, and I was able to feel resistance, so cranial nerve 11 is intact. Lastly, I'm just going to look at his trachea. Mr. Burns' trachea is midline, and I'm also going to palpate. And there are no lumps, masses noted on his trachea. All right. So now I'm moving on to Mr. Burns' eyes. Okay, so looking at the eyes, both of the eyes are symmetric. The eyelids are symmetric, and they are symmetric and equal. There are no redness, swelling, lesions, or exudate. The eyebrows are symmetric. The eyebrows are symmetric, and then they curl up in a way, and then they also curl down in a way. Let's see here. Okay, and now Mr. Burns, looking at the outer canvas of the eye, it lines up to the top of the ear, so it is set appropriate. And then also I'm going to look at the sclera. Can you open your eyes for me, Mr. Burns? His sclera is white. There is no redness, swelling, lesions, or exudate. I'm going to pull down on your eyes, Mr. Burns. Pink, looking at the conjunctiva is the pink undertones, and there is no rashes, swelling, lesions, or exudate noted. Mr. Burns, I'm also going to look at your pupils. So Mr. Burns' pupils are equal, round in size. They are reactive to light. And Mr. Burns, what I'm going to do, I want you to follow my pen. And accommodation is also noted. Now, moving on to the ears. The top of the ear, both line up at the outer canvas of the eye, so they are in place. The external ear, looking at the external ear, there is no redness, swelling, lesions, or exudate or incisions. Looking at the back of the ears, let me look at the outer ear there, no redness, swellings, or lesions. The back of this ear, so both ears bilaterally behind the ear, there is no skin breakdown. Looking at the external auditory meatus, I don't see any redness, any swelling, no cerumen noted. Again, he also has piercings in his ears bilaterally, but they have both healed with no healed with any problems. Mr. Burns, you wear any hearing aids?
No, I do not.
Okay, and are you in contact with any environmental noise?
No, I am not.
Okay, all right, thank you. All right, so now I'm going to move on to the cranial nerve 8. For this cranial nerve, how I'm going to test it, I'm going to do a whisper test. Mr. Burns, I'm going to whisper something in each ear on each side, and I want you to repeat it back to me, okay?
A, B, C.
Okay, now the other side.
1, 2, 3.
Okay. So Mr. Burns' cranial nerve is intact. Okay. All right. So now I'm going to look at Mr. Burns' nose. Mr. Burns' nose is midline to the body. There is, and it's appropriate to the rest of his facial features. I don't see any redness, no swelling, no lesions, or exudate there. And I also don't see any drainage coming out of his nose. Now I'm going to look up your nose. Okay. Looking up the nose, I don't see any foreign bodies. The septum is midline, and then there's also no drainage noted as well. Mr. Burns, can you close one of your nostrils for me and breathe in, and then do the same for the other one? Are there any, did you have any problems breathing, Mr. Burns?
No, I did not.
All right. Okay. So thank you. So both his nostrils are patent. Okay. All right. So moving on, I'm going to look at Mr. Burns' mouth. Looking at the lips, they are pink, moist, and intact. Mr. Burns, can you open your mouth for me? Okay. Looking inside of the mouth, Mr. Burns' teeth, they are white, they are straight and aligned. Looking at the inside of the mouth, at the pharyngeal wall, looking at it is pink, moist, and intact. Looking at the top of the palate, the soft and the hard palate, both are pink, moist, and intact. Mr. Burns, can you say ah?
Ah.
Okay. And then can you stick out your tongue for me and move it side to side? Okay. So doing that with Mr. Burns saying ah, that was testing cranial nerve 9, so that is intact. And then also when he stuck out his tongue and moved it side to side, that was testing cranial nerve 10, so his cranial nerve 10 is also intact. Next, we're going to move on to the chest. So looking at the anterior chest, it is even and symmetric. I don't see any respirations. I don't see any. Looking at the chest, it is symmetric. He has symmetrical respirations. The costal angle is roughly around about 90 degrees. The transverse ratio is 2 to 1. There is also, I don't see any workup breathing. He's not using any accessory muscles. And then also there is no intercostal muscle retracting. The way Mr. Burns is sitting, he is sitting straight. He is erect. I don't see any signs of any kyphosis, lordosis, or scoliosis noted. All right. So now I'm going to listen to Mr. Burns' lung sounds. Okay, so Mr. Burns, while listening to your lung sounds, each time I move, I want you to take a deep breath in and out for me, okay?
Okay.
Right upper lobe. Left upper lobe. Right middle lobe. Left lower lobe. Right lower lobe. Left lower lobe. His anterior chest sounds was clear, vesicular sounds throughout. Can you please turn around for me so I can do the posterior? Thank you. Right upper lobe. Left upper lobe. Left upper lobe. Right lower lobe. Right lower lobe. Right lower lobe. Left lower lobe. Okay. So posterior long sounds or clear vesicular sounds throughout. Thank you, Mr. Burns. Now I'm going to move on to the cardiovascular. So first, looking at Mr. Burns' jugular vein distension. Mr. Burns, can you turn your head to the right? All right, and turn your head back the other way. All right, so there was no jugular vein distension noted. Also, also there is also no carotid artery distension. Now I'm going to palpate the carotid artery. The other side. Okay, so both bilaterally was 2+ regular rate and rhythm. There is also no swelling in none of his arms, his legs, his feet. I didn't see any swelling in those areas. Okay, so now I'm going to listen to the heart sounds first with the diaphragm and then with the bell. Aortic, which is the second intercostal space. The pulmonic, which is the second intercostal space. Erb's point, which is the third intercostal space. Tricuspid, which is the fourth intercostal space. And the mitral, which is the fifth intercostal space. So S1 and S2 are heard, no S3, S4, or no murmurs noted. So now with the bell. Aortic, pulmonic, which is the second intercostal space. Erb's point, which is the third intercostal space. Tricuspid, which is the fourth intercostal space. And the mitral, which is the fifth intercostal space. S1, S2 heard, no S3, S4, or no murmurs heard. All right, Mr. Burns, are you in any pain?
No, I am not.
And all right, do you need anything?
No, I do not.
Okay. So now I'm going to make sure the bed is locked. I'm going to make sure the rails are up. And Mr. Burns, here's your call light. If you need anything, please don't hesitate to reach out to me. Thank you so much. And then now I'm going to perform hand hygiene on my way out. Thank you.
Thank you, ma'am.